Hello, this is Dr. Salim Ahmed, and then today we are going to do vaccinations and immunization. So let's start with a case. A 3-month-old baby is presented with fever, cough, rhinorrhea of 3 days duration. On examination, active healthy looking child with occasional smiles. Axillary temperature is 37.2 degrees. Baby is treated for common cold. However, you realize that the baby has only had BCG vaccine since birth. What vaccinations would a child require at that age? What vaccinations are contraindicated? When should the child return for follow-up vaccinations? What will you do if the baby's mother is HIV positive? What if there is a history of sickle cell disease? Will you vaccinate a preterm baby? So we will come back to this case after we go through the presentation. So let's start with some definition of terms. So what is immunization? So immunization is the biological process of conferring protection in a human host against infectious agents in the environment. Vaccination, on the other hand, is the act or practice of inducing a non-immune person a primary response such that on the first contact with the corresponding pathogen, a rapid secondary response is mounted, leading to prevention of symptoms. So those are the two terms that you need to know. So let's go through the revised immunization schedule in a newborn or a baby. So at birth, what vaccinations are given? So at birth, BCG vaccine, which stands for Bacillus calmette guerin, is a vaccine that is used in the prevention of tuberculosis. So BCG vaccine is given at birth intradermally 0.05 drops, and oral polio vaccine is given through, as the name goes, is oral, so it's given orally, 2 drops, that is at birth. So one thing you have to know about BCG vaccine is that according to World Health Organization, it provides is partially effective and provides some protection against severe forms of pediatric non-pulmonary tuberculosis such as TB meningitis, but is unreliable against adult pulmonary tuberculosis, which accounts for most of TB disease burden. So at birth, you give BCG vaccine and oral poliovirus vaccine. So at 6 weeks, you give oral polio vaccine 1, DPT, which stands for diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza B types. And then you give pneumococcal vaccine, rotavirus 1 vaccine, all given intramuscularly, except oral polio vaccine, which is given orally. At 10 weeks, the same thing is repeated. Oral polio vaccine 2, DPT, hepatitis B, Haemophilus influenza virus type B, rotavirus type 2, rotavirus 2, pneumococcal vaccine 2, all given intramuscularly. And these are the dosage. You give 2 drops of oral poliovirus, you give 0.5 mils of diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza type B, and you give 1.5 mils of vial of rotavirus, and then you give 0.5 mils of pneumococcal virus. At 14 weeks, the same thing is repeated. Oral poliovirus 3, diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza type B. Rotavirus is given, pneumococcal virus is given, same route of administration intramuscularly except oral poliovirus. At 6 months, vitamin A is given, 1000 international units orally, 1000 international units. Why vitamin A? Vitamin A is essential for functioning of the immune system and healthy growth of the development in children. So at 6 months, vitamin A is given. At 9 months, you give measles, rubella, and yellow fever subcutaneously, 0.5 mils. Measles, rubella, and yellow fever subcutaneously. At 12 months, vitamin A is given again, 2000 international units oral. Route of administration is oral. At 18 months, you repeat measles, rubella, vitamin A. 0.5 mils of measles rubella, vitamin A, 2000 international units, and then you give meningococcal vaccine type A. So you give meningococcal vaccine 0.5 mils intramuscularly. Vitamin A is always given orally, and measles rubella is given subcutaneously. So one thing you have to know is that vitamin A is given to the child every 6 months. So the child is 5 years old. So after the 18 months, every 6 months, the child has to receive vitamin A until the child is 5 years old. So other vaccines that it's important that we should know as well. So let's start with human papilloma virus. So human papilloma virus causes cervical cancer, which is the fourth most common cancer in women. So HPV vaccine prevents cervical cancer by preventing infection by various HPV types. Two HPV vaccines are currently pre-qualified by World Health Organization, a bivalent and a quadrivalent vaccine. Both vaccines are highly efficacious in prevention with virus types 16 and 18, which are together responsible for approximately 70% of cervical cancer cases globally. So the ideal age groups: girls between 10 to 13 years, but it's not a standard target age groups. So let's go to rabies. Rabies is a zoonotic viral disease which infects domestic and wild animals. It is transmitted to other animals and humans through close contact with saliva from infected animals. Once symptoms of the disease develop, rabies is fatal to both animals and humans. Two types of vaccine protect against rabies in humans exist: nerve tissue and cell culture vaccines. Currently, the World Health Organization recommends replacement of nerve tissue vaccines with more efficacious, safer vaccines developed through cell culture as soon as possible. Cell culture vaccines, which are more affordable and require less vaccine, have been developed in recent years. So the vaccines, the first one is nerve tissue vaccine. It's more reactogenic and may cause severe, even fatal encephalitis. The second one, on the other hand, cell culture vaccine, is life attenuated, is more safer, and the route of administration is intradermal. So one thing you have to note is that chloroquine prophylaxis suppresses the antibody response to rabies vaccine, especially if it's given intradermally. So what will you do? Post-exposure management and prophylaxis. What will you do as a doctor at the emergency department if someone presents with a dog bite? How will you manage this patient and give prophylaxis to that patient? So what you do is that firstly you have to do your primary survey. You have to do your ABCs. If the patient is hemodynamically stable and the airway and breathing is alright, is patent, you rest and immobilize the limb. You wash with soap and water. You give tetanus shots and prophylactic antibiotics. Then this is very important. You ask about the vaccination status of the dog, whether the dog was unprovoked or not, whether the owner can be found, and if the dog is available for observation. If you are not clear with the questions, give rabies shots. Rabies shots should be given if the dog has no history of vaccination and cannot be captured for observation. So post exposure prophylaxis, you do your primary survey, immobilize the limb and wash with soap and water. Sometimes if the wound is an open wound, you irrigate with a normal saline, and you do not cover the wound. You give tetanus and prophylactic antibiotic, and you ask about the history of the dog and the owners. If the history is not clear, give rabies shots. So let's go to varicella. Varicella, also commonly referred to as chickenpox, is an acute and highly contagious disease. It is caused by primary infection with varicella zoster virus. Following infection, the virus remains latent in the nerve root cells or in the dorsal root ganglions and may be reactivated, causing a secondary infection, herpes zoster, commonly referred to as shingles. So one thing you have to know is that even this varicella virus, the person gets a primary infection as chickenpox, and later after the infection is gone, it is always sometimes may remain in the nerve root, dorsal root ganglia, and may be reactivated. In some cases it may be reactivated, and sometimes it could even cause a facial nerve it will maybe cause a facial nerve paralysis. It's called Ramsey-Hunt syndrome. All right. So the vaccines that are given is live attenuated single antigen, or in a combination with mumps, measles, rubella. So the doses is 3 months apart for children 12 months to 12 years of age. So influenza virus. Influenza is a contagious acute respiratory illness caused by influenza virus. It's usually influenza type A or B subtypes. Influenza can cause mild to severe illness, and it may predispose to exacerbations of underlying disease or development of secondary bacterial infections. Well-established influenza vaccination recommendations include adults older than 65 years of age, individuals with chronic illness, residents of nursing homes and long-term healthcare facilities, residents of nursing homes and long-term care facilities, individuals capable of transmitting infection to high-risk patients, pregnancy in the second and third trimester. So what are the types of vaccines that we have for influenza? One is called whole virion vaccine, two is called split particle vaccine, and three is called subunit vaccines. Let's move to typhoid fever. Typhoid fever is a systemic infection caused by Salmonella typhi or paratyphi, usually through the injection of contaminated food or water. The acute illness is characterized by prolonged fever, headache, nausea, loss of appetite, and constipation or sometimes diarrhea. Three typhoid vaccines are currently recommended for use by one, an injectable typhoid conjugate consisting of viral polysaccharide antigen linked to tetanus toxoid protein, licensed for children from 6 months of age and adults up to 45 years of age. Two, an injectable conjugate polysaccharide vaccine based on purified viral antigen, also known as VIPS vaccine, for persons aged 2 years and above, and an oral live attenuated TY21A vaccine in a capsule formulation for those over 6 years of age. WHO or World Health Organization currently recommends vaccination to control endemic fever and for outbreak control. Among the available typhoid vaccines, TCV is preferred at all ages in view of its improved immunological properties, suitability for use in younger children, and expected longer duration of protection. The World Health Organization further recommends that all typhoid vaccination programs should be implemented in context of other efforts to control the disease, including health education, such as primary and secondary prevention, water quality and sanitation improvement, and training of health professionals in diagnosis and treatment, tertiary prevention. Hepatitis. So hepatitis A. Hepatitis A is a viral liver disease that can cause mild to severe illness. Globally, there is an estimated 1.4 million cases of hepatitis A every year. Unlike hepatitis B and C, hepatitis A infection does not cause chronic liver disease and is rarely fatal, but can cause debilitating symptoms and lead to acute liver failure, which is associated with high mortality. So one thing you have to know that mode of transmission, hepatitis A and hepatitis E, is transmitted through fecal-oral. So it's transmitted through fecal-oral, and BCD is transmitted through blood and bodily fluids. And one thing you have to know about hepatitis virus is that all of them are RNA viruses except hepatitis B, which is a DNA virus. All of them are RNA viruses. So hepatitis A virus, the name is picornavirus RNA, no carrier state, little likelihood of chronic liver disease. hepatitis A vaccine in the form of formaldehyde inactivated. So let's move on to cholera. Cholera is an acute intestinal infection caused by ingestion of food or contaminated water with the bacterium Vibrio cholerae. It is a disease of poverty, closely linked to poor sanitation and lack of drinking water. It has a short incubation period of few hours to 5 days and is characterized in the majority of cases by acute profuse watery diarrhea lasting for 1 to few days. In its extreme form, cholera can be rapidly fatal. Currently, currently there are three World Health Organization pre-qualified oral cholera vaccines: Dukoral, Shankor, and Uvicor. All three vaccines require 2 doses for full protection. Dukoral is administered with a buffer solution. For adults, require 150 ml of clean water. Dukoral can be given to all individuals over the age of 2 years. There must be a minimum of 7 days and no more than 6 weeks delay between each dose. Children aged 2 to 5 require a third dose. Dukoral is mainly used for travelers. 2 doses of Dukoral provide protection against cholera for 2 years. Shankor and Uvicor are essentially the same vaccine produced by two different manufacturers. They do not require a buffer solution for administration. They are given to all individuals over the age of 1 year. There must be a minimum of 2 weeks delay between each dose of these vaccines. 2 doses of Shankor and Uvicor provide protection against cholera for 3 years, while a single dose provides a short-term protection. So there's some common vaccine reactions. Part of the immune system response to vaccine. Generally, fever, local tenderness, pain, redness, and swelling, especially if the route of administration intramuscular, like all intramuscular injections that you see pain, redness, and swelling. Irritability, malaise, and non-specific symptoms commonly associated with DPT. Up to 60% cases, symptoms much less common, up to 10% of cases. Hypersensitivity reactions such as anaphylactic reactions, but are less common. So let's go to our question and then answer it. So a 3-month-old baby is presented with fever, cough, rhinorrhea of 3 days duration. On examination, active healthy looking child with occasional smells. Axillary temperature is 37.2 degrees. Baby is treated for common cold. However, you realize that the baby has only had BCG vaccine since birth. So what vaccination should the child require at that age? Since the child is 3 months of old, the child can receive oral polio vaccine, DPT, hepatitis B, and Haemophilus influenza type B. The child can also receive rotavirus. The child can also receive pneumococcal. Vaccinations that are contraindicated in this child is measles, rubella, yellow fever, meningococcal. Remember, as we discussed, measles, rubella, and yellow fever are not given until the child is 9 months, and meningococcal is not given until the child is 18 months of age. When should the child return for a follow-up vaccination? So the child should return after 3 months. Since the child is 3 months, after the next 3 months he will be 6 months, and he must come back for vaccine. He must come back for vitamin A shot, which will be given orally 1,000 international unit. What if the baby's mother is HIV positive? If the baby's mother is HIV positive, vaccine should not be withheld in the baby. However, you must avoid BCG and yellow fever vaccines. So the vaccine should not be withheld, but you must avoid BCG and yellow fever vaccine. What if there is a history of sickle cell disease? The vaccine should not be withheld. Vaccination should not be withheld in a baby with a history of sickle cell disease. Vaccinations should still be given. Vaccines should still be given. And the last question, will you vaccinate a preterm baby? The answer to this question is yes, you would vaccinate a preterm baby. Why? Because much of the immune system development occurs in the first and second trimester during pregnancy. So response to antigen in preterm is not significantly different from term babies. So vaccination should still be given. So that's all for today. Thanks. I hope you like the video. Like and comment and share, and then give me interesting questions and cases, and I will try and discuss and present it to you. Thank you and hope you have a nice day.